Host today, Beurer is a 100-plus-year-old company that is currently bringing hundreds of digital wellness innovations to the US and digitizing our medicine cabinets with items like the #1 blood pressure monitor at Walmart, TENS technology, and other tech that you should have all received when you RSVP'd for this panel. Beurer has invited esteemed medical experts in women's health to demystify some important health topics on everyone's minds. Our panelists today include Dr. Akua Ampadu, a board-certified internal medicine physician, Dr. Carolyn Moyers, a board-certified OBGYN, and Dr. Anjali Malik, a board-certified fellowship-trained breast imaging radiologist. And we also have Cassandra Bond from Beurer. She is an experienced product development professional with the health and wellness industry, focusing on advancing Beurer's range of products.
So I'm Dr. Ampadu. As she so lovely said, I'm an internal medicine doctor, specifically a hospitalist. So I'm a doctor that sees patients in the hospital from the age of 18 and up. We see a myriad of adult issues from high blood pressure, diabetes, which are some things we'll talk about today, as well as also seeing things like strokes, falls, orthopedic issues. Outside of working in the hospital, I do have a very large interest in giving medical education to the public, as well as women's and minority health. So that's a bit of a spiel about me. Thanks.
Dr. Malik, let's go on to you.
Hi, I'm Dr. Anjali Malik. I'm a board-certified fellowship-trained breast imaging radiologist in DC. So I detect and diagnose breast cancer using multiple imaging modalities, interpreting them and performing biopsies. I also do general radiology, predominantly a lot of OB-GYN ultrasound. So women's health is definitely at the forefront of my career. Offline, well, online, but out of work, I do a lot of social media advocacy and advocacy on the Hill, fighting for my patients, profession, and public health. So on multiple social media platforms, and happy to do educational events like these.
Thank you. And Dr. Moyers.
Hi, I'm Dr. Carolyn Moyers, board-certified OBGYN and fellowship-trained in neuromusculoskeletal medicine, and I'm the founder of Sky Women's Health, a gynecology and osteopathy practice in the Dallas-Fort Worth area. And I have a lot on midlife and perimenopause and menopause, as well as sexual medicine. And I'm menopause certified.
Thank you. And Cassandra.
Hi, I'm Cassandra, and I do product development for Beurer North America. I love seeing our products come to life and the fact that they can help people with home health monitoring, and then, our Beurer app and how you can really keep track of all of your readings in the app. So everything is at reach for somebody to then share with their doctor. So happy to be here today.
Excellent. Let's start with, some very basic questions. What are some of the top health issues concerning women today?
I think honestly, just being heard by physicians, having their symptoms believed, whether it's pain that they're experiencing of any body part, the symptoms that they're having not just being written off as being hormonal or in their head. So I think women being heard, listened to, and their problems actually being addressed.
I firmly believe that they are really wanting a place to be heard. This is it's been such a challenging time for women's health in recent years. So we're making a lot of momentum in perimenopause and menopause education, and seeing women finally feeling heard has been huge. But this is an area where women oftentimes spend years, suffering, trying to get the care that they need. But we see this in endometriosis and polycystic ovarian syndrome. It's not unique to menopause. It's unique to the plight of women, I believe.
Yeah, and I would kind of just back up what my colleagues are saying, that stress management is also something that's been quite large. A lot of times we as physicians understand and recognize how stress is detrimental to our physical, emotional, and mental health. And a lot of times women, unfortunately, we have this superwoman complex, so we have to manage everything and take care of everybody. And unfortunately, a lot of women have put their own selves on the back burner, and eventually it shows in their physical health, whether it's high blood pressure or even cancer or even menstrual issues, menopausal issues. So I think stress management and kind of taking a lot of the burden off of women is also a hot topic right now.
Excellent. Cassandra, you're developing products for women. What are some of the things that you're hearing that you're developing products for?
Yeah, so actually, one of our products is great for women's health. It's our EM50. We do call it menstrual relief. It's a TENS and heat device. We've actually realized that a lot of women with endometriosis find a lot of relief with this. And it's really, amazing because it not only helps with that pain, but it's really discreet. So it could be worn whether you want to crawl up in a ball at home or you need to be a busy mom or out there in the workforce. You can actually wear it under your clothes, toss it in your bag, and it's really a great product for women's health.
Not just knowing what normal blood pressure and menstrual cycle means should be. Okay. I hate to do, Cassandra, most women don't know how to take their own blood pressure. Can you do a demo for us? Is that possible?
I can.
Okay.
I don't
Okay,
have
okay.
them, but I do have the devices.
Okay.
What's great about our devices is they're really easy to use. There's several features which help you use it in the right way, such as a cuff positioning indicator letting you know that it's on in the right way. Many of our devices also have a resting indicator to make sure that your body is really at rest when you're taking a reading. So some people don't realize you shouldn't really be talking or excited, or you shouldn't have just come up a flight of stairs when you're taking your blood pressure reading. So having that built into our blood pressure monitors ensures that we're getting accurate readings. So yeah, super simple to use, really great features, making sure that you're getting accurate readings. And then many of our devices are equipped with Bluetooth, which allows them to seamlessly transfer the readings onto our app. And then you can keep track daily, weekly, monthly. It has an averaging tool. And then those readings can also be exported to a PDF or a CSV file so that they can be given then to their doctors. And then a really cool feature that we added recently on our app is even if you purchase the entry-level device that didn't have the Bluetooth, we have a feature called Scan and Save, where you could actually take the reading on our blood pressure monitor, have our app, and use the camera function on your app, and it'll keep track of those readings as well. So you can get a digital diary of your blood pressure readings even without having a Bluetooth device.
Good is hormonal shifts throughout a woman's life, hypertension, heart health. I mean, these are the main things that we're talking about. So what are the connections there?
Well, we know as the woman ages, we go through an enormous amount of changes in the hormonal shift. If we look at just pregnancy, if a patient has a history of hypertension in pregnancy or gestational diabetes in pregnancy, they have an increased lifetime risk. And then as we go through the perimenopausal menopausal transition, we start to see more cardiovascular disease with the decreasing estrogen levels. We know that that estrogen is a vasodilator. And so it definitely is a protective factor against cardiovascular disease. And we've seen even most recently in a study last month, indicating that women over 65 on hormone therapy actually have a decreased cardiovascular risk among many other health.
And on that note, we know that it's also safe for women to be on HRT in terms of their breast cancer risk. So we need to be protecting our hearts, we need to be protecting our bones, and the old data about it increasing breast cancer risk. There are so many benefits to hormone replacement therapy, and it is a personalized decision that women should be making with their healthcare providers.
Yeah, absolutely.
It's very important to deal with our mental health along with our physical health.
Excellent. Cassandra, what do you have to help us women monitor this?
Yes, well, I'm happy that Beurer can play a small role with our digital medicine cabinet and keeping track of the blood pressure on our app and our Scan and Save feature. But I want to support these doctors and say that you really need to, I think, advocate for yourself. It seems keep not only a diary of your blood pressure readings, but also any physical changes, and that really helps the professionals here that are on this panel with me. So,
excellent. Does anybody have anything else that they want to add? Any questions from the audience that you want to put in here? If not, I'm going to thank everybody for their time. I think we all learned a lot, and thank our media guests today.